So I am with Premier Health, and I've been with Premier Health since 2001. Just very short background about myself. I'm a licensed physical therapist and practiced. That is really the main thing I've done for most of my career, around 30 some years. And then a couple years ago, I went back and got a certification to become a health and wellness coach. And so the last few years I've been working with Premier Health in a role. My title is technically Wellness Engagement Specialist, so I do a lot of wellness programming, a lot of community and workplace wellness talks, and lots of other things. So I'm excited to be here. I'm passionate about giving people information and letting them think about what they can do and just kind of stir and sit with it. I'm flexible, and if you have anything that you need today during the presentation, feel free to raise your hand and ask. I'll also be available afterwards. I don't have to rush out into this weather, immediately. So I'm happy to have a one-to-one quick conversation with you as well, answer personal questions that you might have or guide you in that manner. But today's topic is joint health, and it is just meant to be an overview of joint health. So let's get started. So our objectives today are, we're going to try to learn together a few things. Learning about what normal joint structure and function is, how movement, loads, and stress affect our joints, changes that we can expect with joint tissues associated with aging, and we're all aging at some level. So I think when we get to this end of the spectrum, we think about it a lot, but as infants, we're changing our joints, changing our bones, all through a lifespan. As young adults, we're changing our joints, changing our bones. So it's just a continuum. So that's important. At any given time, we should expect different things. Just like we wouldn't expect a baby to be capable of certain things, there's times in our lives where our joints are going to be capable of the same things they were at a different phase in our lifespan. We'll discuss briefly a few common joint conditions, just touch on those lightly, and then think about how we can do some different protective things to keep our joints healthy. And then lastly, we'll touch briefly on how and when to seek help for tired, aching joints or other joint problems. Because we don't want to live a miserable life, and there are things that are normal with aging and with changing over the lifespan, but there are also things that are not normal and that can be treated, and you can get better care and better quality of life if you do, hopefully. So let's get started. So what are joints? The joints are simply hangouts where two bones meet. So we want our bones to be hanging out and having a good time together. We want them to be happy together for a long time, so we want to have this great environment for them to do that. So what do our joints do as far as for our body? They shape and support your body. Growing up, somebody may have told you, oh, you have dainty fingers, or oh, you have thick ankles. So we all have just a natural joint shape, a natural body shape that we're given at birth. Joints also make it possible for us to move. We don't really think about that a lot of times until we lose movement and become immobile or less mobile in a joint. But joints have a normal amount of motion that they should have, and again, that varies with different times in our lifespan. But they make it possible for us to move and get around, so we want to be able to do that. They come in many shapes, sizes, and types. They fancy themselves up sometimes and call themselves articulations. So when they're having a good time, they like a fancy word. And then there's no specific, depending on category, around 250 to 350 joints in your body. So every classification is a little different if you look up how many there are. So lots of joints, lots of things are going on. So what are joints made of? So this graphic kind of is a graphic of a knee, just to give you a little bit of an idea of what a joint may look like. But most joints have similar structures. So a joint is going to start with having cartilage. Cartilage is just that really thick, connective, strong tissue that helps lubricate, or not lubricate, but helps like line a joint to keep things moving slowly. So if you're looking at this example here of the knee, it's going to be that part that's the white part like on the top part of the picture above the knee joint, and it's going to be on the bone. And again, just allowing things to glide. So it's going to prevent friction and be a really important surface to keep those joints moving. Tendons, another type of connective tissue. And a tendon is something that is going to connect a muscle to the bone. So you probably have heard of tendinitis or partial tendon tears or different things. So tendon is just a type of thick connective tissue that brings muscle and bone together. So by the way things are placed, that's how we can use certain muscles to move our joints and our bones, and our arms and our legs. And then we have ligaments. And a ligament is a thick fibrous band of connective tissue that connects bone to bone. So if you watch football, and a lot of people are this time of year, you might hear somebody tearing an ACL or an MCL. These are ligaments, right, in the knee. So ligaments stabilize and provide structure and check joint motion. So they're basically holding a joint together when the muscles are not functioning. So they're also a passive way to hold a joint together. So your muscles are going to give it strength and support it, but the ligaments are going to be passive because it's bone to bone. And then lastly, depending on what joint, you'll find other things in there like bursa, meniscus, and synovial membranes. So meniscus are very common, and a lot of people think of that with the knee. So those two things on the bottom part of that are your meniscus, if you're looking at that graphic. And so you will see and hear about people tearing those as well. So they're kind of function a little bit like cartilage in the fact that they protect the bone surface on that particular joint. Bursa are little fluid-filled sacs that help provide a little bit of extra motion and padding for certain areas of your joints. So you can get inflammation there, which we'll talk about. But that's what they are. There's just a little extra padding in certain areas. And then synovial membranes are part of certain joints that basically they're lining inside of what we have a capsule that kind of covers the whole joint. And they're going to be lubricating our joint and providing fluid and nutrients. And we'll talk a little bit more about those as we go on. So these are kind of the characteristics and components of a healthy joint. Everybody doing okay so far? Any questions? Okay, great. So I mentioned that there were 250 to 350 joints in the human body. And there's many different ways to classify them based on what they do, where they are. But in general, most broadly, joints are typically classified by the type of connective tissue that they have. So these three main classifications are what you'll usually find. Fibrous, those types of joints have really thick connective tissue that's meant to really bring things together very strong, not really allow for movement between those bones. So our skulls, when babies, they're molded, and we bring those joints together and we have this really thick tissue, and those are like our skull plates. So that's an example of a fibrous joint. Our cartilaginous joint is one that's going to be cushioned by cartilage and have cartilage as part of it. But it's going to also, because cartilage is a thick fibrous connective tissue, not have a lot of motion. And so certain examples of that are like our ribs when they come into our breastbone. You have a little joint there, but it doesn't have lots of motion, just enough to let your lungs inflate and then deflate. And if you ever pop one of those out, you'll know it because they get really sore. So also we have that type of joint like in our pelvis when we kind of bring our pelvis bones together. So those are cartilaginous joints. And then the ones we're most familiar with and probably thinking about most if you come to this presentation is what's called a synovial joint. So those are those common joints, our hips, knees, ankles, shoulders that have a lot of movement in them. They have the synovial fluid and membrane in them that we talked about at the last slide, which is very important. And these joints come together with these tendons, ligaments, and these other structures, but the bones themselves are kind of like Legos. They want to already fit together. There's a rounded area, and then there's an indented area. We call that kind of convex and concave in medical terms. If you remember that shape of the knee, how the femur had that, the thigh bone had that rounded area, and then the knee was a little bit more like a cup for it to sit in. So the bones themselves should have the shape to kind of fit, and then all the structures around just helps absorb shock, provide friction, lessen friction, and things like that. So when we talk about a healthy joint, we talked about what its function is, but what would a healthy joint's features be? We would have structurally healthy components and features and sensory features that are healthy. So structurally, our joint is going to be moving through that full range of motion, whatever it should be able to do, allow us to do that, but not have a lot of excess motion. So, Our knees shouldn't be bending backwards and things like that. So that's important. It should have full strength to handle the tasks that we're doing every day. So if we're pushing the cart at the grocery, if we're going up and down the stairs, taking a shower, doing whatever we do, our joint should have the amount of strength that we need to do that without having a tissue failure or issues. And then we should be providing that normal amount of nutrients to a joint through our synovial membrane and our circulatory system. So all those things should be features of a nice, healthy joint. All those things should be working together, tick-tock, smoothly. They're hanging out at that restaurant having a good time together. From a sensory standpoint, our joints have a lot of these receptors in there to sense our position in space. So this is how we develop coordination. We know we're standing up and not upside down like a gymnast on a handstand. We are going to be able to react to that, and our muscles are going to recruit properly. So if we're falling forward, we don't want the muscles in the front of our body to pull us further. We want our joint to sense that we're falling forward and it to tell the muscles in the back of our body to pull us up. So that's really important that we have that. And then the other thing, sensation-wise, a healthy joint should have is it should be free of pain. Your joint and the pain receptors are only meant to trigger something that's not a normal movement. So something, or not a normal condition. So if there's inflammation or your body's gone too far out of its normal range of motion, then you're gonna feel pain because some tissue is being damaged. Any questions there? Everybody feel good about? Okay. So now let's talk about movement. So who here thinks movement is probably good for your joint health? Right, yes. So in general, movement is really key to our overall health and definitely our joint health. So why? Why do we have to move when we think maybe if we didn't move, we would just not be putting any pressure or forces on our joint and they would just be better long term? Well, no, in fact, our joints need movement to maintain their day-to-day health. So first of all, when we move a joint through its motion, that is going to help with our what we call lubrication of the joint. So the lubrication is that synovial fluid, that fluid that's going through our joint, and that provides viscosity to keep the joint, just like oil in a car, friction from happening, moving, sliding, gliding properly, that fancy word articulating good we like to use in therapy terms, so that things aren't rubbing together, because rubbing is going to cause tissue damage. And it's going to bring all the oxygen and all the nutrients that your body needs to help heal anything that happens just from our normal day-to-day wear and tear, because we always do little things here and there that irritate it. And also, we're just producing things and it cleans everything up. So it's going to help with circulation of that joint. And when we think about walking and going up and down and just moving around and the different compressions that are on our joints, that helps our cartilage, because our cartilage kind of acts like a little shock absorbing sponge. So when we have weight on it, it kind of pushes the nutrients out, helps kind of clear things out and get rid of things in the joint space. And then when we unload, kind of helps everything come back in and get more nutrients. So it's almost kind of like, just like, again, like a little pump, and just kind of helps regulate that. So circulation and movement in our joint goes hand in hand. So the other thing that does is helps exercise and movement helps reduce inflammation, because when it does that circulation, it's going to clear out those inflammatory molecules that come in when your joint is being reacted to something. It's just like if we get a cut on our finger, anytime we have an injury, we automatically get these inflammatory molecules that come in to heal it, and then we just need to be able to get rid of those things. So important, when we talked about the very beginning, a joint is two bones meeting together, hanging out. We want all of the tissues in that area to be strong. We want our bones to be strong. We want our tendons to be strong. We want our ligaments to be strong. So these are connective tissues. These are tissues that change, especially muscle tissue, based on load. It's going to build up and improve if we exercise and put load on that, the proper amount of load and stress. So that is going to be another important benefit of exercise and movement for joints. So if I ask anybody in this crowd to kind of look at this square choices here real quick, I bet almost everybody would say something about flexibility as you get older. So when you're young, your tissues are automatically more flexible because of the type of connective tissue, the collagen and elastin type of tissues that we have. they've got this great balance. They're like a brand new rubber band coming out of the bag. They pull and they come back. And then as we get older, when we have changes in our collagen, it thins out. We don't produce kind of like the same amount of elastin. We have a different combination. So we're a little bit more like that rubber band that's been laid out and on our index cards for 2 years. When we come out of the drawer, we see it may even be a little bit broken or not even working. So again, it's important that we exercise to maintain our flexibility and keep our ability to stretch without breaking. So moving our joints, doing gentle stretching, all of those things are going to help with those tendons, those muscle tissues, so that we are not getting tight. And the other thing is we have this joint capsule too, so moving around helps keep that loose. If you've ever had an injury where you've been immobilized, you may have gone to therapy and had to have like joint mobilizations, or you may have heard somebody getting like a frozen shoulder. Their capsule tightens down and then they can't move the shoulder very well. So it's important that all these tissues have that full regular range of motion. And then last, but very important as we age, regular movement improves our balance and our coordination. So when we do something, we get better at it. That's the reality. You don't see anybody going to the Olympics and the gymnastics team that just started yesterday. So they put themselves through years and years of training. Their muscles and their mechanoreceptors and proprioceptors of their joint are learning all these different positions. They're realizing when I do this backflip, these muscles have to work. The same is true for us. When we walk, stand, go up and down stairs, do other activities, our body's constantly telling us, even when we're vacuuming the floor, this is what our muscles have to work. This is what has to go first, second, third. It's coordinating it. It's fine-tuning those patterns that we have. So it's very important to keep those going so that when we do our day-to-day task, they're ready to go. It's not a challenge. Our body's not thinking, whoa, what do we have to do now? We can't figure things out. All right, so we've talked a little bit about healthy joints and how they need load and just different mobility and activity. But I do want to spend a moment talking about joint forces and how that changes with the things that we do, because it is very important to move our joints. It's also very important to think about how we do that movement of our joints and not do things that might be irritating or put us at risk for injuries with our joints, and how we can, again, protect them. So I've just got one example here. You could use other examples, but I think the knee is kind of the example, as you saw at the beginning, I rolled with a little bit. And it's easy, and I think most people can relate to knees. And most of us, a lot of times over the years, we'll have little things here and there that happen. So each joint, because it does go through a range of motion, and it does have these contractile muscles and tissues and positions and spaces in it, will have different forces when it's in a different position based on what our muscles are doing and how much they're having to carry a load. So if we think of this in terms of a few things that our knee does every day, or most days, if we have the knee and we're just walking, I'm going to walk across the stage here, then the force on my knee joint is going to be about 1.5 times my body weight throughout different parts of my walking cycle. Now, if I'm going to go up and down the step, then the force is going to be different because I'm going to have more pull for one leg. I'm going to be going up or down, so I have to control the ascent or the descent. So then I'm going to start having a force about 2 to 3 times my body weight on my knee. And then if I'm doing something like squatting deep to tie a shoe, you're getting down like this and you're tying your shoe, or you're squatting and you're bending your knees all the way to pick up an item from the floor and you're coming up. Doing a deep squat, we can have our knee forces go up to 4 to 5 times our body weight. So what does this mean? It just simply means we should be aware that certain things are going to put more forces on our knee than others. And sometimes we may want to minimize that. Sometimes we may not. These are normal activities of daily living. But one of the things that comes into play is thinking about our weight and the loads that we carry around every day. So for instance, if you are a person that weighs 150 pounds and you're going to do these 3 activities any given day, then your force on your knee is going to be 225 pounds if you're walking, 375 pounds if you're going up and down stairs relatively, and there's a difference between going up and down the step a little bit, but we're not going to get into the things so complex. And then maybe up to 675 pounds of force when you're tying your shoe. So if you are a person that is having a lot of extra weight that you're carrying around, it can really affect your knee joints, and that's why it can contribute to be a risk factor for things like osteoarthritis. So even changing your weight by 10 or 15 pounds in that same example can really change the amount of force. So if you lost 15 pounds, let's say, and you were 135 pounds, then you would only be having about 200 some pounds when you're walking. You'd have about 335 when you're going up and down the stairs versus the 375, so that's like almost 40 pounds difference. And then with the squatting, it would be like around 607 versus the 675. So I say this because a lot of times if we are trying to think about our joint health and if we're thinking about losing weight, it can be overwhelming. And we can think, I can't lose 50 pounds and 10 pounds aren't going to make a difference. Well, really, it's very true. All the joints, especially your weight-bearing low joints, your back, your lower back, your hips, your knees, can change their force loads and can improve a lot with just a small amount of body weight. And as a health coach, I would also say it can also, that same amount of weight can help lower your risk for diabetes, help lower your risk for blood pressure and a lot of other health conditions. So things to consider. But the one thing also on this is it's not always a great idea to squat and tie your shoe. It's better to probably sit, cross your leg, things like that. Same thing with kneeling. Kneeling has a lot more force, and you're also pushing your kneecap kind of because it's in a fixed position on the floor up into that joint space more. So kneeling is one of the worst things you can do for your knees as well. So think about how you're moving, do things, still go up and down stairs, great for your heart, great for exercise, great for things, as long as your knees are healthy, but just think about how your body weight does change. And then also think about if you're carrying a little laundry up and down the steps, or you're carrying your daughter's furniture from college up and down the steps, or other kind of things. I have these kind of examples now, so they're fresh on my mind. All right. So now we're going to talk about stress and joint health. So again, we're just kind of going through some different things that can affect the health of our joint. This is one thing I don't think people think about a lot. But I like to talk about stress. There's almost no health presentation that I do that I don't talk about stress, because stress affects all of our body systems. And why? When we feel a perceived threat, which is what the definition of stress is, unexpected kind of perceived threat, our body just reacts because we're meant to protect ourselves, right? So it's going to release cortisol, adrenaline, some other hormones, but cortisol specifically is going to do things like raise our blood sugar or blood pressure, but it's also going to start making our muscles, certain muscles especially, tight and tense because we were kind of preparing ourselves to protect ourselves and preparing ourselves for action. And so what happens is we have certain areas of our body that are sensitive. So who in here has worked for some part of their life? Okay, great. And who in here, when they were working, maybe had a day or two they felt stress? Yeah, I know. See, we laugh, so it's true. So, and who in here may have ever come home with either a sore neck or a headache? Right, yeah, we just feel it. We hunch over, and a lot of us are hunched over because of work, but even if we're not, when we get tense, our upper neck muscles, our head, our face, our jaws can tight. You can even see sometimes, when people are getting mad, they're clenching their jaws, their faces turning red, that blood pressure. So we have these areas that are sensitive, and it's going to lead to postural changes, and that can affect our joint health, because if we do that a lot and we get stressed a lot and we're not ever just relaxing, resetting our joint, then over time our postures are going to change, our tissue is going to change. It's going to be more difficult for us to get into good positions and to relax. And then stress, also these hormones start causing a cycle of inflammation, and inflammation is going to be harmful to all of these different parts of our bodies, but these are going to trigger inflammation in our joints as well as it would trigger inflammation as things circulate throughout our body. And then lastly, who in here has ever lost a night of sleep because of being worried about something? Yeah, so the other thing that stress and worries cause are interruptions in our sleep, which is already a big challenge as we get older because we already have changes in melatonin and other things that affect our sleep. So sleep is when our body, and especially our immune system, kicks into high gear and does its repairs. So if we're not sleeping well, then our joints are not going to have the tissue repair that they need to have as well. So overall, we have talked a lot about the things that normally happen in our joints, and then we've talked a little bit about different loads, and now we're going to talk just the next few slides about specific changes that are normal aging. So this is normal aging response. This isn't something that you haven't that you've been going every day and banging your head against the wall, and you've been doing these crazy things to your body. This is just what happens to all of us, even if we're trying to take care of ourselves, eat right, exercise, get some sleep. Each decade, past our 30s, we start losing muscle strength. We also can lose endurance and flexibility because the tissue changes. So a lot of this is we decrease in how we make protein. We also we don't repair the same way. We can change the way we eat a lot as we get older too. A lot of times people don't have the same appetite. They don't eat as much protein. They maybe have lost a spouse or be alone. They don't have to cook as much for family. I'm in that transitional area where sometimes I like to cook, but now that I don't have to cook, I feel like, okay, well, it's not really worth my effort to make much tonight. So we can just change our eating patterns as we get older for many reasons. But it's important that we continue to eat good, healthy food, which we'll talk about. So that can cause those, again, changes in strength and endurance and even flexibility, especially if we're not staying hydrated. And then our bones are going to shrink a little bit in size and density, and we're going to become more susceptible to fractures as we age, especially women, but anyone as they age gets more susceptible. And then again, hormonal changes in our composition. So our muscle tissue changes composition a little bit. I talked about our connective tissues to change composition. Our bone changes composition a little bit as we age too, and even more fat can kind of go into our bone marrow. And then our cells just do not turn over as quickly as we get older. That's why we see all the changes that we see, really, is we're just not getting those new cells regenerating. We're also sometimes not getting things cleaned up as much in our joints and our tissues and taken away. Specifically to joint structures, when we talk about those structures that we were talking about composed of the joint, cartilage itself becomes a lot thinner as we get older. So it's not going to have as much of that density to do that sponge absorption and changing in the nutrients, and have that flexibility too, so it can tear and things like that easier. Synovial fluid changes as we get older. The composition of it changes, so we don't have the same amount of viscosity that we have. So if you think of other things that are viscous in nature, like I said, I talked about oil earlier, kind of being a good lubricant. If things are going to change in viscosity, they're going to change in the ability of shock absorption and things like that. Our ligaments, tendons, cartilage change collagen structure and their tissue structure, so that's going to make them a little less flexible. And then certain joints have a little bit different range of motion norms as we get older because of those changes in the bone structure. And some of those are like joints in our neck. We have a little bit limited, more rotation normally a little bit, and the ability to kind of look up, just different things. Hips the same way. We might not be able to kind of extend our hip back as much and bend our ankle up as much. So there's certain joints that have a normal kind of change because of the fact of these joint structures and tissues around them changing in motion. So we want to make sure that we can keep them as loose as we can and moving as much as we can. So now let's just talk for a few minutes about some common conditions that can affect our joints that you guys might have heard of. And there's lots of different ways to talk about these and classify them. So we're not really here to talk about and diagnose conditions, but I just want to give you kind of an overview. And I categorize them this way because of that. When we think about a lot of the common joint issues we have, they can be related to disease, inflammation, and usually injuries. So that's kind of how I like to think about it. So the diseases we put over here on the left column here, so you might have something like rheumatoid arthritis. That's something that you need to be talking to a doctor about. It's blood factor and inflammatory, but also autoimmune. So these categories, the rheumatoid, the psoriatic, the lupus, those are all autoimmune. So those are diseases that your body's kind of attacking itself for different reasons with each disease. But again, that's kind of the process. So it's going to be causing a lot of issues, and you're going to need medical care for those kind of things. And they're a little bit different category than some of the inflammatory conditions. They can be both because, like I said, when things go wrong, inflammation in general happens. But there's sort of another component to these autoimmune diseases. So in the middle is one of what we really kind of think about, like osteoarthritis, inflammation that's causing these conditions. So osteoarthritis is the most common cause of arthritis, and what most people think about when the bone starts going on the bone, hip or knee replacements, creaking, things like that. And then bursitis is just an inflammation of those bursas, those little fluid pads we talked about. A lot of times that will happen in hip or knee, but it can happen in other places as well. And then tendinitis is an inflammation of those tendons. So Again, the tendon's going from the muscle to the bone, so it could be the tendon in your kneecap. A lot of people get in their elbow, but anywhere you have a tendon, you could technically get tendonitis. So again, it's just inflammation. So these are conditions that start out with an inflammatory cycle. At some point, the joint or the tendon or the bursa is having a little more wear and tear or having some kind of irritation, and it's starting out as an inflammatory cycle. So that's why a lot of times when you go for treatment for these, your doctor may prescribe like an NSAID and like, maybe icing or just different things because they start out as an inflammatory condition. And sometimes rest, the right amount of rest or guided movement, I should say, not overuse. And then injuries can start out with any injury, right? You can fall, unfortunately, break your hip. You could have a dislocation of your shoulder or your hip if you had a really, bad car accident or other things like that. And then sprain, you can roll yourself on the sidewalk, sprain your ankle. I've done that, different things like that. So it's kind of good to think about how these can occur because that will kind of help you realize like what you also need to do like to kind of treat them. So I think we've been talking about movement, so I'm going to do just a little movement break just so you can get an idea of what you could maybe do to give yourself some circulation and lubrication and some lengthening in your tissue. So if you're sitting all day and you've been looking down or reading or working on cooking or doing something, then one of the best things you can do is try to kind of change that and stretch. So just here in your seats, I'm going to get back a little bit. I'm going to have you guys just kind of take a deep breath up. We're going to move these ribs a little bit in the shoulders. So try to inhale and bring your arms up comfortable. Good. And then exhale down. And then you can take an inhale and bring your arms back if you can behind your chair and give yourself a little stretch. And then exhale and relax that. And then sometimes even just taking your hands to your shoulders and just rolling them around in and out a little bit. And if you do stuff with a breath, I think that's good too. And then just kind of doing the opposite can help release the tension and stress. I get a lot of times people asking me, should something be clicking or popping? Well, that kind of depends whether or not you should move through that based on how it feels. But most of us get a little clicking or popping or sometimes. So I always tell people if you do that, the first thing I would do is just not go quite as far with something. So if you're clicking and popping here, just take her down just a little bit and see if you can do it. But again, just a little bit of movement. So I really don't like people to sit and stay in the same place for more than an hour, try to move around a little bit. It doesn't take much, but just something. So let's talk about moving properly and being smarter with our joints. This is a couple things that you can do for all your joints, but specifically your back, your hips, and your knees. Bending and lifting. We never really want to just bend over and lift something. We're not using our muscles in the proper way. We're going to be putting pressure on our discs. So a lot of times you hear of people having a herniated disc. That's how these kind of things can happen, or blowing out their back or things like that. But we really have our strong muscles in the body, and our power muscles are in our thigh and in our butt. That's why if you watch sports, you usually see really good ones, right? Really good thighs, really good tushes. So those are meant to do our power, our lifting. Our other body muscles in the core, our stomach and our backs, they're meant to stabilize us all day long. So they're more endurance type of muscles. So when we want to lift or bend or do something, we really want to line our core up more straight, and then we want to bend with our hips and our knees and use those big muscles. So we want to go closer to something. We want to pivot if we have to. We want to think of pulling in our abdominals. Hopefully you've never had this happen, but I always tell people if you think about being punched in the gut, automatically drawing that belly button in, that kind of helps you stabilize your abdominals when you're getting ready to do something. So get close, bend hips and knees, keep your body and your core engaged, take your time, and then step and pivot rather than twist. Twisting is one of the hardest things that you can do for your back and your knees. So it's an easy way to injure yourself. Ask for help. Who has ever lifted something in here and then later wished they would have asked for help? Yes, and at all ages, right? We all tend to want to overestimate our strength, or we just don't ask for help. Everybody I always talk to loves help. Most people love helping people, but no one loves asking for help. So I think, well, how is anybody ever going to get to enjoy helping somebody if there's nobody in this world that ever asks for help? So it's kind of one of those oxymorons, but so try to do that. And then the other really good thing with the joints, I'm not talking about walking or doing things that, swimming or bicycling, but try to avoid repetitive extreme movements. So, for instance, if people are working and they're laying carpet all their lives and they're really doing, their knees are all bent and they're doing that, they have better ways some now, but they have tons of bursitis and issues with their knees later on. Same things if people are working overhead, when the end of your range of motion in anything, to work and to repeat a movement there, it's just not a great idea. So that's when most of our joints at the end ranges of our motion are getting more pressure and more compression, so we don't have a lot of space there. So just think about the things that you're doing and think about how you might be able to do them a little differently, not as long at a time. I think the one thing sometimes nice about being a little older is we don't always rush to get things done as quickly. Maybe, I don't know, maybe that's just depends on the person, I'm sure. But you may have a little more time in your schedule, so you don't have to finish it right now. Then just give yourself a little more time. So if you are at the point in this presentation where you're thinking this is a good idea, maybe we should start becoming a little more active, how would you start? Where would you start? What might you want to do? So let's talk about how we could do an activity program for just helping our joints and our general health. So one of the most important things you can do is find a safe, well-rounded program. I think, all my years as a physical therapist, the type of people I see the most unlucky because have an accident, or people who have not moved at all, or people who have moved way too much, way too extreme. So really it's about finding that balance and doing more than one thing and doing different things. So try to think about when you're working around your house, moving, picking up things, reducing loads, strengthening your core, things that you can do around your house just day to day. But in your program itself, think about a few different components if you're specifically wanting to improve your joint health. Think about strength. That is super important. Strengthening or resistance exercises are going to help improve your bones strength, decrease your risk for fracture. And remember, a joint is two bones hanging out together, having a good time. Then it's going to increase your muscles and decrease that rate of muscle strength loss, so you're going to help build up the muscle tissue. The more you can build up your muscle at any age, the better you're going to be able to function, and it's not going to require so much effort, so it's going to make your life easier. And then having balance and flexibility. So again, being able to move your joint through that normal motion and not have everything be a stretch. So like if I'm not very flexible, if I just go down to here to get my cup of coffee in the morning from the counter, then that's going to pull my back. But if I'm really flexible and this is my normal, then going to here is nothing, right? So it's not going to strain my tissues or cause any damage. So we have to think about that. And then if you have an issue with your weight, by being way overweight, then think about maybe how you could manage that to improve your joint health. Activity-wise, as far as impact, we want to do some weight-bearing exercises to strengthen our bones, but we also want to think about spending some time in lower impact activities so that we're not really putting a lot of compression on our joints. So walking, swimming, cycling, any kind of water program you can do. And water programs can be resistance. People don't think about that, but people can use resistance things in the water. So there's a lot of things that you can do to unload your joints, but also still strengthen yourself. Great heart rate increase usually with water programs. Tai Chi or yoga or Pilates, all those kind of things are great for coordination, balance, stress reduction. Remember we talked about stress? So those are some of the exercises that you get, like a lot of different things in one package. And whenever you do, if you haven't done a strengthening program before, I would recommend you go in easy. You get some consultation about it and think about starting with a really low load and see how things go. I also tell people when they start an exercise program, start one or two new things and then do it for a while to make sure it's not causing any aggravation. If you start 5 or 6 things and then 3 days later something's bothering you, you don't know which one of the things it could have been, and you may throw in the towel for everything, when in fact maybe 5 of the things were perfect, but that 6th thing was really what was the one thing that was causing the problem. So take time, take notes, see how things go. Usually 2 or 3 days. If you do something, it's usually 2 or 3 days later you're going to notice, and if it's not been by then typically as long as you continue to ramp up gradually, you'll be doing well. Some resources, I'm not going to go through these, but I think if you do have joint issues like arthritis type of issues, the Arthritis Foundation has wonderful resources, and there's exercise videos for different, like 10-minute videos for different kind of general exercises, parts of the body. There's lots of recognized physical activity programs by the CDC that are actually approved for arthritis that are evidence-based. So it's nice to kind of go in and look at those. And then we're going to shift to some nutrition for joint health because that is important. Why? So we talked about how those categories, autoimmune, injury, inflammation. So inflammation is a big part of chronic disease. It's a big part of joint health, arthritis, things like that. So if we can shift and eat a little bit better, then we can maybe decrease a little bit of our inflammation in our bodies. And then also, because certain structures are joints like the bones, et cetera, have certain needs, we want to make sure we're getting the nutrients we need for that. So definitely you need your calcium, vitamin D, you need your protein for your muscles, and then you also want to get fat and antioxidants and vitamin C so that you're, again, taking away that inflammation, taking away those free radicals and things like that. So a lot of us know about anti-inflammatory foods, but they're pretty much all the foods that you know are good for you. So fruits, vegetables, healthy fats like avocados, your fish. We'll go on to the next slide. Lots of things thinking about leaner meats that aren't as inflammatory. And then definitely hydration. So I talked about how water with the cartilage and different things can help bring the oxygen and the nutrients in and out. All of our body needs water, but definitely all of our soft tissues need water to keep that flexibility. So keep drinking that. A lot of us when we get older too don't want to drink as much because we don't want to worry about having to go to the bathroom too much, but that's not a good thing. That can actually make it worse sometimes. But the good news is for our joint health, nutrition is the same thing that's best for our overall health. So the slide here shows the different recommendations. The CDC recommendations are basically whole foods, fruits and grains, low-fat dairy and lean protein, and then making sure we watch those big three, sodium or salt, fat, and sugar. And then these other two columns, Mediterranean diet and the DASH diet, if you haven't heard of those, you can look those up a little bit, but they're specific diets that are geared for actually more heart health and blood pressure, but are also considered to be anti-inflammatory diets. So both the Mediterranean diet and the DASH diet have research that backs them for making good improvements in different things that relate to heart health and then also anti-inflammatory for joints. Then of course there's these complementary therapies, heats, colds, your arthritis creams, things like that that can be sometimes helpful for joints, braces and orthotics, devices. So things like using a cane can take off that, we talked about those forces and with the stairs and with the knee, well, the same thing with the hip. If you use a cane, it can take off forces for your hip and your knee. So those are things that you might need to do or want to do at some point if you're having pain with certain activities or longer distances when you're out walking about. And then there's mixed reviews and evidence about acupuncture, but there's still parts of the world that like that for pain relief, relaxation for stress. Sleep, again, is a big thing for keeping yourself healing and keeping your immune system intact. Managing stress, we already kind of talked about that a little bit in the last slide, but anything that you can do to manage stress is going to also be good for your health and again for your joint health. And what I like about this, I just kind of kept a slide up because I think a lot of the things like the Tai Chi and yoga and the relaxation techniques are really things that are good, again, for the muscle tension and the joint health. So lots of things you can do there. So when and how to get started. So first of all, ask your doctor before you make any big changes in your lifestyle. It's always important because even though a lot of us have great ideas and good intentions, everything should be done in the right balance and with the right information. So check in with your medical provider. For exercise, again, we talked about start slow and gradually make changes. And I would say the same thing is true for nutrition. Like when you're getting ready to start and make changes, A lot of times, just like exercise, people can give up diets because it's too much too soon, or you might even have some, if you eat tons of fruit and beans and or nuts, you could have some trouble with your gastrointestinal tract right away. So, just think about making a couple changes. And when you make one or two small changes, it's much easier to keep for long term. So I think that that's important. Find a way to make something social and fun. Do something that you enjoy. That'll make it more likely for you to stick to it. And then again, I really think it's a good idea to keep track of things so that you can make sure that you know what you've done, how it worked, and then what could you change or what do you want to keep doing. It's kind of like your own little way of figuring things out, your own little journal. And if you're not sure about going to the doctor, just go to the doctor. That's what I tell people. Because if you're questioning going to the doctor, there's a reason. You're not in your normal state of health, or you wouldn't be thinking about going to the doctor. But above and beyond that, if you're not sure, you can use a few guidelines. So, give yourself a couple weeks of rest, maybe some, if it's joint, maybe some, little bit more limited mobility, doing some cold or icing routine. And then if things aren't improving, then go to the doctor. But you shouldn't go long term. And I love this term with healthcare and medical care in general called shared decision making. You'll see that in some of the clinical guidelines if you do research any of those I showed you on that other slide. But your doctor and your medical providers can only take care of you with the information that they know. So it's important for you to keep them up to date with what's happening. So that, a lot of times we can minimize what we're feeling or thinking, and it's important to just share that information. Your doctor can decide if it's not, important. And on the flip side of that, if there are things that your doctor's recommending and they're not something that you're buying into, then that's important for you to let them know, because if you just sit there and say that you're going to do it and then go home and don't do it, then that's not helping either one as well. So it really is a shared relationship and shared decision making. So seek help definitely if you have persistent pain, if your joint looks out of shape, you can't move it properly, things like that are clear, obvious signs that you should be going to the doctor. If you feel any sudden swelling or heat, definitely if you get red inflammation, something puffs up, that's an inflammatory spot that's pretty significant. So you probably want to get on that at the beginning to make it hopefully heal as quickly and easily as possible without complications. And then the big thing is, if you're starting to change your quality of life and ability to perform what you do every day, then it's a good time to start talking to somebody about that. Because we may have to make some adaptations as we age, but we shouldn't be impairing our quality of life or giving up everything that we like to do. So it's really important that you think about that. Thank you guys. I'm sorry it was so cold. Thanks for coming today.